Good morning, everyone. Welcome to Bree's Science Lab. Today we are going over the scapula, or shoulder blade, the clavicle, or collarbone, the humerus, or arm bone, the two forearm bones, known as the radius and ulna, and the hand bones. So, to start, we're going to go over the scapula. Now, the scapula is pretty easy. You just want to make sure you orientate yourself first, right? So this is our front side or anterior side. So it's super smooth, not a whole lot going on. But the posterior side has a lot more going on, right? So this is the back side. You might even be able to feel some of these structures if you reach your hand back there. Sometimes like the medial angle or the lateral angle or the spine, right? This is going to be inferior and this is going to be superior, so at the top. Now, to determine if it's medial or lateral, you want to just look at this because this is where your humerus is going to connect, right? So let me flip it over so you can see the anterior side. So it's going to connect like this, and this makes up your shoulder joint, okay? So this goes right here in the glenoid fossa, and so if you think about it, your arm is lateral to your shoulder, right? So this area is always going to be facing laterally, and that is the best and easiest way to determine what direction it should go, right? So if we think about it, if this is the front and this is medial, okay, that means this is lateral, so this is a right scapula, okay? So let's go ahead and start now that we've oriented ourselves, let's go ahead and start naming some structures. The first structure is super easy. This is the subscapular fossa on the front. The subscapularis muscle attaches here. It's one of your 4 rotator cuff muscles. This is your superior angle. All right, your superior angle. This is your inferior angle. This is your medial border, your lateral border, okay, your lateral border. This is your scapular notch. You can see a little divot right there, right? Your scapular notch, all right? From this side, you can also see the acromion process, and the coracoid process. The coracoid process, okay? And how I like to think about it and remember those two processes is acromion starts with A, coracoid start with C's, and A's are better than C's, right? For grades, A's are above C's. So that's how I always remember it, because any way you look at it, the acromion is always going to end slightly higher, right? You see that? So it's just the easiest way to remember that. Now, we are going to look right here and go over this angle. Now, this is still our medial border right here. This is our glenoid fossa, okay, our glenoid fossa. This is what articulates with the head of the humerus to make up your shoulder joint. Up here we have our supraglenoid tubercle. Depending on what bones you have, it might be hard to see, especially if they're made from plastic, but that's like a little bump right there, and it's going to attach to some of your muscles. This is going to be the attachment point for that. This is your infraglenoid tubercle. So one of your triceps will originate from there. One of your bicep muscles originates from the supraglenoid tubercle. There's just a whole lot, right? Now, this is our acromion, as we said, and this is our coracoid. Now we're looking at the posterior side. So let's reorientate ourselves. Lateral border, medial border, inferior angle, superior angle. Now, this was our acromion process, right? We're looking, it's higher, acromion process. If we follow it down, what is this? This is the spine of the scapula. The spine of the scapula. So it's, you know, kind of like a spine. There's going to be a lot of things that attach there too, muscle-wise. And then above the spine, you're going to have your supraspinatus fossa. And yes, your supraspinatus, another rotator cuff muscle, will attach there. This is your infraspinatus fossa. So this is where your infraspinatus is going to go. Okay, and that is the scapula. So a very cool bone, one of the most interesting in my opinion. And so now we are going to look at, let's look at the clavicle, okay? The clavicle, because it's really interesting because you actually have an acromial end. And I think that's important because the acromial end is actually going to attach with the acromion process, right? To make up your collarbone. So to orientate yourself when it comes to a collarbone because it's kind of difficult. The flat end is going to be your acromial end, right? Your acromial end. The other end, it actually attaches to your sternum. So this is the sternal end, all right? Or the sternal end. So let's see where it articulates with the sternum. Now, to differentiate top from bottom, or superior from inferior, you're going to look for smoothness versus roughness. The inferior part is going to be very rough, okay? And so that's how you're going to know it's on the bottom. You also are going to have this little bump. This is called your conoid tubercle on the acromial end. The conoid tubercle. You can kind of see it if I move it around right there. Conoid tubercle. Don't get that confused with coracoid process because they both start with C and they're near each other. Now, we're going to look at the humerus. So, like we said, the humerus is going to articulate with the glenoid fossa to make your shoulder joint. So this is the humerus in its entirety, and we know that this is a left humerus because this is the anterior side, and this right here, the head of the humerus, is going to be medial because it articulates with the glenoid fossa and it makes up the shoulder. So that has to be medial, or it has to point towards the central part of the body, if that is an easier way of remembering it. And this is anterior. We know that because the lesser tubercle is more obvious, but also if you can see down here at the elbow joint, you have two smaller fossa. If you look at the back or the posterior side of the humerus, it has just one giant fossa, okay? That's known as the olecranon fossa. Now, going back to the front, let's go over some of the structures up here. These are very important because you'll have a lot of muscles attached to the greater tubercle and even the lesser tubercle from the shoulder region. So, like we said, this is the humerus, okay? This is your lesser tubercle, so it's a little smaller than the greater tubercle, which is also more lateral, okay? So it's more lateral. The lesser one's always going to be more visible from the anterior side. In between those, we have the intertubercular groove or the intertubercular sulcus. If you follow the lesser tubercle down, you're going to have the lesser tubercle crest. And the same with the greater side, the greater tubercle crest, just kind of going down. They're just like little raised lines. Now, going around here, so all the way around, going right there, that is the anatomical neck of the humerus, anatomical neck, okay? However, this portion right here, that is the surgical neck. So there are two necks, just because anatomically it's this, but when surgeons go in, this is usually the part that's going to be broken, you know, so this is more surgical neck, right? So now if we go more inferior, we're going to see this kind of rough portion right here. I don't know if you can see that rough portion, and that is the deltoid tuberosity. Now, the deltoid tuberosity can sometimes actually be like a little raised bump, and that's just because the deltoid muscle attaches there, and as you're growing, it's going to pull on the bone, and it's going to pull it out. So sometimes there's like a raised bump, and I just don't want you guys to be surprised if you see that on radiology or something. Moving further inferior, I'm going to kind of zoom in so you guys can have a better view of that. This right here is going to be your medial epicondyle, okay? This right here is going to be your lateral epicondyle. So those condyles are epi because they're just like above, right? These ones. These can also be called condyles right here, but they actually have more specific names. So we're going to go over those. Let me see if I can. Nope, I guess not. Okay, well, we're just going to do it like this. Okay, so this is going to be your radial fossa, right? Your radial fossa and your coronoid fossa. Coronoid fossa. Now, how do you know that this is the radial fossa? This is because it's more lateral, right? So we haven't done the forearm bones yet, but you have a bone called the radius and the bone called the ulna. The radius is on the thumb side, so when you're in anatomical position, that's going to be more lateral, right? So this is more lateral, so this is called the radial fossa. However, this one is where the ulna sometimes articulates when you're in flexion, and this is the coronoid fossa because the coronoid process of the ulna articulates here during flexion of the elbow. If we go down, we have the capitulum, all right? The capitulum and the trochlea, okay? So the capitulum kind of looks like a baseball cap if you look at it from this way. So that's how you can remember that it's capitulum. Now, if we flip it over, we're going to see some of the greater tubercle. You're still going to see the head, the anatomical neck, and the surgical neck. You're also going to have a radial groove. You can't really see it on here, but it's going to be posterior. This is where the radial nerve will go along the posterior of the humerus. So the radial nerve innervates the posterior muscles of the arm. And so that's a good way to remember that the radial groove is going to be on the posterior side. Now we're going to look at the olecranon fossa. This is the olecranon fossa. So when your arm is extended or straightened, the olecranon process, all right, of the ulna is going to articulate there. So if I show you like this, okay, that is kind of what it looks like, right? And so if I show you it from the front, it's going to go like that. And so this is the coronoid process, and this is the olecranon process. So they just go in their determined fossas. Besides that, you can also see the condyles, epicondyles still from this side. So just remember, because it's flipped over, you're going to have the opposite sides, right? Okay. Now, let's go ahead and do the ulna first. So this is the ulna, right? This is the side bone that's going to be on your pinky side or more medial. This is the proximal end. This is the distal end, okay? This is proximal. You're just going to have to remember, this is what makes up your elbow, okay? So this is the olecranon process, all right? And the coronoid process, all right? This is going to be your radial notch. That's where the radius kind of articulates with it right here. See that? And then if you go down, we have this end, which is the head of the ulna, and then we have a little styloid process too for the ulna. And this is going to articulate with your, well, it doesn't directly articulate with the carpal bones, but it's going to be near there. Your radius is this bone right here. This is actually the head of the radius, and the head of the radius is going to be more proximal, or it's going to be the part that's closer to your elbow. And so this articulates with the capitulum, like that, okay? And you have another styloid process down here, and you also have this, which is going to articulate with the carpal bones, okay? Specifically like the scaphoid, and we'll get to that. You're going to have a radial tuberosity right here, and I forgot to mention on the ulna, you have an ulna tuberosity too. And that is it. And just remember that, like, if you see this is where it articulates. This will be your ulnar notch, so it articulates with the ulna there. So for example, it's going to look like that. See, little notch, just like we have a notch up here. Just like we have a notch up here for the radius, okay? Now, last but certainly not least, we have the hand, okay? So we are currently looking at the palm, okay, which is, I think, the easiest way to learn it. And it's a little jumbled, but so you can see if I line it up on my hand, oops, well, we can try like that, okay? So those are fingers down here, our metacarpal bones, and our carpal bones. So these are like your wrist bones, right? Now, I'm going to go ahead and put it down. We're going to go ahead and zoom in a bit. Okay, so if this is our left, right, the radius is going to be articulating with this bone here, okay, and the ulna is going to be on this side, right? So to start, we have the scaphoid bone, the lunate, the triquetrum, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. And on the hamate, you'll notice this little notch right here. This is the hook of hamate, and the hook of hamate can only be seen from the palm side, okay? Let me move the light a little bit brighter. There we go. So you can see this little hook right here, that is only visible on the palm side, and that is on hamate bone, so it's called the hook of hamate. Now, how to remember these carpal bones? Super easy. There's tons of mnemonics, but the one I use is some lovers try positions that they can't handle. Okay, so if you take the first letter of those, it corresponds with the first letter of the names of the bones. Okay, so scaphoid, just remember that is going to articulate with the radius. This right here, trapezium, since there's a lot of bones that start with T, the reason I remember it is triquetrum is tri, so the third one in the mnemonic. Okay, trapezium always articulates with the thumb, so U, trapezium. Thumb, U, is also in there. And then trapezoid kind of looks like a trapezoid, and it's just the last one that we don't have anything special for. Now, the hook of hamate, so you actually have the ulnar nerve running through here. So if you break this bone, the hook of hamate, or you fracture, whatever, you could damage the ulnar nerve, actually. And don't forget, pisiform is out here, but sometimes you cannot see it from this view, okay, depending on how the hand is positioned. And let's see, there we go. Now, the other kind of interesting parts of this is the scaphoid is the most, it's going to be the most fractured bone, right? Where the lunate is the most dislocated bone. So if someone's asking you, what is most commonly fractured in the wrist? Scaphoid. What's most commonly dislocated? It would be the lunate, okay? Then we're going to go to the metacarpals. You have 5 metacarpals, starting with the thumb, first metacarpal, second metacarpal, third, fourth, and fifth. So that's super easy. Fifth one is going to be your pinky. It's sometimes known as the digiti minimi also, and the thumb is known as the pollex, okay? And all of these that keep falling around everywhere, these are your phalanges. You have 3 of them on all fingers except for your thumb, okay? On your thumb you have 2. So you have a proximal phalange and a distal phalange. And then all of these, you have proximal, middle, and distal, okay? So you have a distal joint and a proximal interphalangeal joint. Now, the distal one is where your flexor digitorum profundus actually attaches, and this one is actually where your flexor digitorum superficialis attaches. So kind of fun. So if you flex your hand, you know, this digit is flexing because of the profundus, where this digit right here, the proximal interphalangeal, that is, clearly I don't have one, that is due to the superficial muscle. And that is the palm. Now, if you flip it over, it does look a little bit different, so just heads up. You're still going to have the mnemonic. So some lovers try positions, and then switch, that they can't handle. Anyways, I hope you enjoyed, and please leave any questions in the comment section.